Catherine Sutton. I'll be your student nurse today. We're going to do a full head-to-toe assessment. So tell me your name and date of birth.
Nicole, December 18th, 1998.
Very nice to meet you, Nicole. So that makes you 19, almost 20?
Yes.
All right. And what do you do? Do you go to work? Do you go to school?
I go to school.
And where do you go to school?
Colby Sawyer.
Very nice. And for what major?
Nursing.
All right. So I'm sure that's pretty stressful. What are some things you do to alleviate some of your stress?
Exercise and meditate.
Very nice. And going to college, you eat at the dining hall?
Yes.
Okay. And do you feel as though you get a good balance, 3 meals in a day?
Yes.
Drinking lots of water?
Yes.
Okay. And how do you feel overall today?
Good.
Good? Okay. And do you have any pain?
No.
All right. So on a scale of 0 to 10, 0 being no pain at all and 10 being the worst pain imaginable, what would you rate your pain?
0.
All right. So I'm just going to get started. We're going to start up at your scalp and your head and then work my way down, okay? All right. So I'm just going to look around through your hair. Your hair texture is even. And I'm looking for any lesions or bumps through on your scalp, and everything looks really good. And do you have any problems with dizziness?
No.
Headaches?
No.
All right. I'm just going to feel your ears. Is there any tenderness?
No.
Okay. And I see you have your ears pierced. Do you do your best to clean those out, clean out your earrings, stay away from infections?
Yes.
All right. So we're just going to test your hearing, okay? So close your eyes and tell me when you hear my fingers rubbing.
No. No.
Okay, good. So now we're going to move to your eyes, and I'm just going to shine this light in your eyes, okay? And watch your pupils dilate. So just watch my finger. Good. Other side. Good. Okay, so now we're going to do confrontation. So just take your hand and place it over your eye and tell me when my fingers come into view, okay?
No.
Okay, and then other side.
No.
Okay, good. And now just follow my finger with your eyes and don't move your head, okay? Okay, good. And do you wear contacts or glasses?
No.
And do you feel as though you have no problems with vision?
No.
And how regularly do you see your eye doctor?
About every year to every 2 years.
Okay. And it is winter outside, so the air is pretty dry. Do you feel as though you have any problems with sinuses, breathing through your nose?
No.
Okay, so just to test your nose, can you cover one side and then breathe in? Good. And then other side. All right, and now we're going to move to your mouth. Do you have any problems eating, chewing, or swallowing?
No.
Okay. And about how regularly do you see the dentist?
Every 6 months.
Okay. So we're just gonna look in your mouth. Open wide. I'm gonna place this on your tongue and press down. Can you say ah? Perfect. And now I'm gonna look at your cheeks. Good. Good. Now I'm gonna look at your lips and your teeth. Everything looks really good. Okay, can you stick your tongue out for me and then side to side and then up like this? Good. And can you say light, tight, dynamite?
Light, tight, dynamite.
Perfect. All right. All right, so we're just going to test some muscles in your face. Can you raise your eyebrows up and then frown and then close your eyes really tight? Resist me opening. Perfect. And then can you smile and then show teeth? Good. And then puff your cheeks out. Good. All right, and then I'm going to test strength in your face, okay? So just push against my hand. Perfect. And then other side. Good. And then resist me pulling down. Okay, and then a few movements in your head. Can you bend your head down and then back? Good. And then ear to shoulder. Good. Any problems? Anything hurt?
No.
Okay, and then side to side. Good. And everything was fine with that?
Yes.
Okay. All right, so now I'm just gonna move down to your neck. Is there any tenderness when I touch your neck?
No.
Okay, good. All right, I'm gonna check and make sure your trachea is midline. Perfect, and now I'm gonna feel for your carotid. Good, and now I'm gonna listen. Good. Okay, good. And when I felt for your carotid pulse, it was strong, and then when I was listening, there were no bruits. So everything was good and normal. All right, so now I'm just gonna have you resist me pushing down with your shoulders, and before we go to the respiratory assessment, I'm just gonna feel, is there any tenderness in your arms?
No.
All right, and I'm just feeling for warmth. Your skin is warm. Now I'm gonna look for capillary refill. Good, and now I'm just gonna look for turgor. Good, and then just place these, and I'm gonna feel your pulses. Good, and those are strong as well. Okay, so I'm just gonna feel around in your chest. Just let me know if anything hurts, okay? Everything fine?
Yes.
Okay. All right, and now we're gonna do tactile fremitus. So I'm gonna place the palm of my hand on your chest. Can you just say 99 for me?
99, 99, 99, 99,
I'm gonna go down here.
99, 99,
Okay.
99, 99.
Okay, so resonance was good. And now I'm gonna percuss. And I'm gonna go down here. Good. And the other side. Okay, good. And now I'm gonna listen. All right, so when you feel my stethoscope on your chest, you take a deep breath through your mouth, okay? If you get lightheaded, we can stop. Okay, I'm gonna go down here. Good. Feeling okay?
Yes.
Okay. And last one. Okay. So now I'm just gonna feel for symmetric expansion, okay? So I'm just gonna pinch a little bit of skin right here. Can you take a deep breath through your mouth? And good. All right, so now we can do the back, so you can go ahead and turn around. All right, so just tell me if anything hurts, if there's any tenderness. All right, and again, we're gonna do symmetric expansion. I'm just gonna pinch a piece of your back. Just take a deep breath in through your mouth. And good. All right, And tactile fremitus, so when I place the palm of my hand on your back, say 99 for me.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, good. And now we're gonna percuss. I'm just gonna move your sports bra a little bit. Okay, and then same on the other side. Okay. Good, and then down here. Good, and now I'm just gonna listen. So same on the front, when you feel my stethoscope, just take a deep breath in through your mouth. Feeling okay?
Yes.
Okay, good. All right, so you can actually turn back around and lay down. All right, so now I'm just gonna look at the veins in your neck. So can you turn your head that way towards the curtain? Good, and then the other way. Good. All right, so now I'm just gonna look for your apical pulse and the contour of your stomach. Good, now I'm gonna feel. And now I'm gonna listen. Okay, good. So now I'm just gonna listen over a few places on your chest, so just sit tight and relax. I'm just gonna move your hair. Okay, and for your apical pulse, I'm gonna listen for a full minute, okay? good. So you got 70 beats per minute, and that's within normal range, so that's perfect. So now I'm just gonna listen to a few spaces over your abdomen. Do you have any problems with digestion?
No.
And do you have bowel movements regularly and no problems with those?
No.
Okay, good. So again, just sit tight. Okay, and now I'm gonna percuss. Okay, good. And now I'm just gonna feel around over your abdomen, and I'm gonna go shallow, and then I'm gonna go a little bit deeper, okay? So tell me if anything hurts.
Okay.
This feels fine.
Yeah.
Okay. Now I'm gonna go a little deeper. And I see that you have a belly button piercing, so same as the ears, you're cleaning that out, trying to stay away from infection?
Yes.
All right, and everything was good. Okay, so now I'm just gonna move down to the legs. I'm just gonna feel, do you have any tenderness in your legs when I touch?
No.
Okay. And your legs are warm and your hair distribution is even. All right. And now I'm just gonna feel down by your feet. Your feet are a little colder, but that's totally normal. All right. And so now I'm gonna feel for your pulses in your legs. Good. And now I'm gonna feel down by your ankles. Good. And now on your feet. Good. And now can you push down on my hands like your gas pedals? Good. And then pull up. Good. Okay. All right. So now I'm just going to test range of motion in your legs before you sit up. So can you lift this leg all the way up? Good. And then bring it back down. Good. And then out to the side. Perfect. And then bend your knee and bring it up to your chest. Good. And then the same on the other side. All the way up. And then side. Good. And then bending your knee. Good. Any problems with that?
No.
All right. So now I can have you sit back up. All right. And same as the feet, I'm going to have you push against my hands and then pull. And then we can test the arms. So can you raise your arms all the way up? Good. And then back. And then in a circular motion. Good. And then out like this. Resist me pushing. All right. And then go bring your elbows like this. Same thing. Good. Any problems with that?
No.
Okay. So now we're going to test a few things with sensation. So I'm just going to take this cotton ball, and can you tell me when you feel it on your face, okay? So close your eyes.
No.
Good.
No. No. No.
And then I'm going to do the rest of the body.
No. 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 No.
Okay, good. And now we're going to do what's called sharp and dull. Okay. So this is the dull side, and this is the sharp side, okay? So I'm going to place them around your body, different sides, and can you tell me which side it is? All right, so close your eyes.
Dull. Sharp. Dull.
Good.
Sharp. Dull. Sharp.
Good.
Dull. Sharp.
Good. Okay. And before I have you get up, can you do heel to shin? So both heels down your shins. Good. All right, and then this is kind of tricky, but touch your nose to my finger, and I'm going to move my finger to different places, okay? Good. Good. All right, so now you can get up. And when you walked in, your gait was good. So I'm just going to have you walk towards the curtain on your tippy toes. Good. And then back on your heels. Perfect. And then just a little bit heel to toe going that way. You don't have to go too far though. Perfect. All right, and then come back, and I'm just going to test your balance. So just stand, close your eyes. I'm going to stand here and make sure you don't fall. Okay, good. All right, so you can sit back down. And one question that I should have asked during the respiratory assessment was if you have any shortness of breath lately or any cough. So do you have either of those?
No.
Okay, so that is all for our head to toe assessment. It was very nice to meet you, Nicole.
Nice to meet you.